So is chiropractic useful, any value for newborn babies? Excellent question, and the answer is a resounding yes. Now, why is that? Well, because when a child is being born, it is obviously a very traumatic experience for the child, but also for the mother. And we'll come to the mother in a minute. But for the child, the spine, the neck, the whole pelvis, everything is put under a considerable amount of stress as it comes through the birth canal, as it comes through, if it's a vaginal birth, then it's really important that the child is checked at some stage. Now, most of the time, parents will wait until the child has some difficulties. For example, it may have some difficulties latching on to the mother's breast. It may have difficulties with digestion, for example, colic. It may have some issues with moving the neck, or it just may be a baby that's having a sense of uncomfortableness and is not comfortable in any position because the spine has undergone a lot of stress as it's been born. And of course, sometimes difficult births, for example, where the child might be breech and has to be moved, where the child is pulled out with forceps and creating incredible stress on these wonderful vertebrae in the neck, but very sensitive vertebrae in the neck. Also, maybe a more aggressive mode of getting the baby out using a ventouse, which can end up with a cone head in some babies. So all of these are really very traumatic on the baby's very sensitive and emerging, developing nervous system and spine. So it is important to get the baby checked. And over the years, 25 years, I've checked thousands of babies in my time. And it would be an honor and a pleasure to check your baby. Hi, Dr. Sandhu here from Bedford Chiropractic Clinic, answering a question which is quite high up on the list of frequently asked questions, which is about newborn babies. And the answer is yes, we can help newborn babies, and I personally have treated many newborn babies that have suffered from sort of just being able to turn their neck, to being just generally uncomfortable, not resting, not being able to sleep, to obviously the classic colic conditions as well. So that's the baby. So we do treat babies, and we do treat obviously a whole range of age groups. So we are here for the whole family, from baby right up to my oldest patient is 96 this year. So from a week-old baby, a day-old baby, to 96 years old. Let's go back to the mother, because obviously the mother has undergone the trauma and the experience of giving birth to that baby. And the pelvis is certainly one of the areas that takes an enormous amount of stress. When the mother is in labor, she begins to produce hormones to help her to open up her pelvis to allow the child to come through vaginal birth. And the hormone oxytocin makes the muscles and ligaments, especially in this joint right here, this foundational joint for the pelvis, a link joint for the pelvis, to go all soft and floppy so that the mother then can obviously allow the baby to come out. But there is no guarantee, and regrettably it doesn't always get checked, or ever, that the pubic symphysis has gone back into the right position. And in over the 20 plus years that I've been in practice, what I have found is that 90% of my female patients that have hip problems, back problems, pelvic issues, knee issues, originate from the fact that the pubic symphysis wasn't checked after giving birth, and the pubic symphysis is still unstable. So one of the things that we do here is we check for that with every person, every woman that comes in, and every male as well, because males can also experience pubic symphysis dysfunction after an accident, but it's obviously much more prevalent and common in females. So that is one of the things that we check. So, and it is really important to get that checked as well. Let me just show you this as well, because we are prepped to treat sort of mothers that are heavily pregnant as well. This special cushion was made by a chiropractor, a female chiropractor who was pregnant, and she wanted to continue to have treatment. So she designed this to specifically fit the pregnant mother into it. So the mother is able to lie sort of prone, and I can then examine her and treat her properly and examine all her spine and check her pelvis out as well. So we are here for you if you have just recently given birth, and you and your child are maybe struggling, or maybe one of you is struggling and the other one's okay. It doesn't matter, we're going to check both of you. And there is a special promotion that we're doing at the moment where if the mother books in, the child gets checked for free. If the child is booked in, the mother gets checked for free as well. So Bedford Chiropractic Clinic. Now, do follow us on social media, do follow us on our YouTube channel as well. And if you know somebody who is just recently given birth, or new parents who are struggling with their baby because of some movement difficulties, because of colic, because of discomfort, then please share this video with them and let me help them. And I look forward to helping you if you need me. Now, highly encourage you to check out some of our other YouTube videos. There's lots of really educational videos that are available to you on this channel. Lots of frequently asked questions that you may have about chiropractic and if it can potentially help you. And your questions will be answered. So have a great day. And remember, there is no greater wealth than health. God bless you.